All right, welcome back. This is Bjorn Martinoff, your main host for today, filling in for Marlene Crack, who we miss dearly. With me is my wife, partner, and co-host, Vicki Martinoff, and our wonderful, stunning guest, brilliant doctor, Dr. Sharon Rebong. Welcome back.
Thank you.
We were just touching on some subjects. You said you wanted to add some more points of view.
Yes, you were asking about what we can do regarding those patients with chronic illnesses like diabetes and cardiovascular illnesses like hypertension, blockages in their heart. So aside from the lifestyle, the diet, and correction of the nutritional deficiencies, we also need a patient to go through some form of detoxification and other forms of treatment, to remove the blockages in their circulatory system, particularly the arteries. Because if the arteries are plugged, nutrients will not pass through more efficiently. Oxygenation in the different parts of the body will not be as good. And that will lead to symptoms of ischemia. So, for example, in the heart, it will cause chest pains, or in the brain, dizziness, and maybe lack of clarity of mind. So, and even in the other parts of the body, you won't feel well. So it will be good to not only clear one part of the system, like the brain or the heart, but clear everything. And you can do it by, we have what we call chelation therapy in the clinic, where we help the body eliminate the heavy metals that can act as free radicals and cause damage to the tissues of the arteries.
When you say heavy metal, is calcium a metal? In that aspect?
It's a mineral.
It's a mineral.
Yes. So, in one way, it also helps remove the calcium plaques. Okay, but basically, we want to remove the heavy metals, like the lead, the arsenic. And they can do harm to the blood vessels.
And then somebody said that you actually helped a patient that was 99% plugged but couldn't afford heart surgery. You were able to help him with his chelation, or was it a combination of things?
It was a combination of things. Primarily, we did a series of chelation together with supplementation and other herbal preparation to remove the blockages, to smoothen the flow of the blood. So it's a combination.
So chelation therapy, what does that look like?
It's a preparation. Chelation comes from the word chelate, from the Greek word which means to claw.
To claw.
To claw.
Oh, okay.
So particularly the EDTA, that is, we are using EDTA. It's infused in the fluid, IV fluid, and we let the patient have an intravenous drip of that for about 3 hours. And as it passes through the blood vessels, and whenever it gets in contact with the heavy metal, so it helps pull it out.
So the body can eliminate it.
And the body eliminates it through the kidney.
Through the kidney.
Yeah, so that's the process of chelation.
But how does that then remove the plaque, like when somebody's arteries are plugged up?
Aside from removing the heavy metals, it also removes the plaques, the calcium plaques, and as it's being removed, it is being transferred to other parts of the body where it's needed. So it's, how do you call that? It is being rechanneled.
Okay, where it's appropriate.
Yes, where it's appropriate.
And so can heart surgery be avoided sometimes that way?
Yes, there are cases wherein heart surgery can be avoided. Like in that particular case, of patient where we had a series of chelation therapy. He didn't have to go through angioplasty or bypass.
Wow, that's
Yes.
of course that's very invasive, right? It takes a long time to heal, you know? And
And he
well, I
has
understand you
removed
can-
removed his medications.
medications like
He
diabetic
has gone
medication?
back to his exercising,
Mhm.
jogging without experiencing the chest pain.
Wow, that's amazing, huh?
Yeah.
So somebody who's basically ready to be scheduled for heart surgery now regains his health without being cut open.
Yes.
Right.
And the good thing about it is you are not only clearing the clog, the
Mhm.
specific
Like
clog,
that one spot.
in that one spot. You are clearing everything.
Mhm. What's
Head to
the
foot.
yeah? So it basically cleans out your entire system, not just in surgery. You take care of 1, 2, 3, or 4
that
spots,
problematic
right?
spot.
But not the rest, right?
Yes.
And so, and they say that even if you do have that surgery, you can come back within 6 months, right? Is that true?
Yes, that's
Okay.
why you have to really, on the part of the patient, he has to have some changes in his lifestyle. So make healthy choices in the food, maintain supplements that will continue to improve and prevent inflammation
Mhm.
in the body.
What causes inflammation? Is it just the pH, or what is it, the toxins, the parasites? Bacteria?
The free radical injury can
Okay.
cause inflammation.
What's free radical?
Free radical injury is, say, those heavy metals,
Okay.
and our body's natural metabolism is such a way that we naturally produce free radicals, and if we lack the nutrients to counteract it, then it can cause injury, even to the blood vessels, the inner lining of the blood vessels. So that free radical can cause injury.
Which the body then tries to fix with the cholesterol. or
Yes, the body.
layers.
Yes, the body tries to fix the inflammation in the blood vessel by attaching the platelets, the cholesterol, okay, which
Which will
actually
build up over time, no?
build up over time and can cause blockages. Infection can also be an inflammation. In fact, one of the lectures I've heard from a cardiologist is that if you are not able to correct hypertension,
Mhm.
and you have tried medication and you have treated him with nutrients and other stuff, look for infection because it can also add.
Isn't hypertension like, it's just high blood pressure? Isn't high blood pressure just the body trying to pump blood into areas that sort of are restricted? And so by increasing the pressure, the body is trying to get blood into those areas?
It's a general increase in blood pressure, which the body tries to, the heart tries to pump as hard through a narrowed, reactive blood vessel. Yeah.
So the body,
It's not as pliable as when you were younger,
right,
where
right.
the muscles can accommodate the flow of blood and it can contract better.
So basically the body is trying, the heart is trying to get blood into where it's difficult to get blood into, but if we take then, let's say, medication that lowers the blood pressure, is that not counteracting that, what the body is trying to do? Or?
Well, it tries to relax the muscle, the reaction of the blood vessel muscle a bit, you know, like the calcium channel blockers. But it will not correct the condition. What is causing the high blood pressure?
Okay.
What happened to the blood vessels?
So it's just trying to relax the blood vessel.
Yes, and try to control the input of the electrolytes, the sodium, potassium.
So it's more going
influx.
after the symptom rather than the cause.
Yes, so you can do more while you are giving the medications. You can do more and improve the health of the blood vessels when you do chelation, when you detoxify, when you give
So in
nutrients.
addition to those medications.
Yes, and then maybe you can, later on you may remove. So for example, in the case of I give an example. My father is developed hypertension in his 70s. He was actually very adopted a very healthy lifestyle. He tried his best, no? Even when I was still, I was not in alternative medicine or integrative medicine. But later in life, at past 70, I noticed that his blood pressure started to go up. So at one point in time, we had to give him medication. But after a while, we say a year, it doesn't respond anymore. So my doctor friend had to change it. So after that second drug, what I did was to give him the regular intake of the preparations that we give for hypertensive. Okay, and after two months, I think, his blood pressure went down.
Wow.
So we were able to remove his medication. So his blood pressure even went down at 90/70 or 100/70 without getting dizzy. So we did some chelation on him, and then supplementation with the nutrients that his body needs in order to improve to correct the inflammation, and then the protective preparation of Panax, not the ginseng. And it's now more than 4 months, or maybe around 6 months now, that we are enjoying treating him without the medication. So we're just maintaining him with supplements. And he feels good.
He feels good.
He feels good.
Nice. But you also supplement the chelation with something called hydrogen peroxide. Say a little bit more about that.
Okay, we call it biooxidative drip. Okay, so it's a medical grade hydrogen peroxide, which we give intravenously to patients.
It's not that we want to have blonde hair in our arteries.
In layman's terms, what it actually does, it helps stimulate the different systems, even the hormonal systems and the immune systems in our body to remove inflammation and to facilitate healing. And it this protocol is I have adopted from my mentor, Dr. Chat Austria, and she has incorporated it in the chelation therapy program to help, and it produces good results with patients going through the chelation protocol.
Very nice. And it actually also, there's an economic benefit of going this route rather than surgery.
Oh yes. I don't have the exact figure, but it will not cost you, say there's a patient needs to have 500 to 700,000 for a surgery, or maybe more than that, but this is much affordable.
Much more friendly on the wallet. Right?
Yes.
Okay. Does insurance also cover it? Or is that still
sadly not yet.
Not yet.
I hope we will be given the opportunity to be covered, even partially.
Yes.
Because it will really benefit the patient, and it will not be as costly for the HMO.
Yeah, so the insurance would actually also benefit.
Yes.
Right? So it's something that we should encourage them to look into.
Yes.
Yeah.
We have been trying.
That's good.
To present this idea to HMOs.
Are there some HMO that are more friendly towards natural ways of healing than others? Other than, maybe we don't want to mention any names, but are there, or are they pretty much all the same?
I think more and more of them are open to it. In fact, they are offering, for example, where we hold our clinic, is I believe allowing us to be in their facility and allowing other services, like they have choices of healthy, they have a restaurant there, and food stuff they can buy, which are healthier, is one way of being open to the idea that healthier lifestyle and other alternatives are helpful for the patient.
Yeah, and also I think it's good for the shareholders for the HMOs, right? Because
For everyone.
after all, if you spend less, and you go the more you keep, right?
Yes.
Yeah, yeah, and it's not just that way for the HMO, but also for the private patients. You know? If you can avoid heart surgery, why not? Or maybe if you can extend your life for a few more years, maybe 10, 20 years. In my case, I'd be very happy because my children are still very small, and it'd be nice to see them graduate from college. It'd be nice to see them get married and have children when they're grown up.
Yeah. Again, I would say that it's an investment. As you invest for your wealth, for the future of your children, for your family, for yourself, you want to enjoy the fruits of your labor. You also want to enjoy it with a healthy body. Your mind is still clear, you don't have as much aches and pains, and you're not suffering from any serious illness.
So by the time those grandchildren come around, you can actually get on the floor with them and also play with them, and not just sit there in your chair and observe from far away. You know?
Yes.
Yeah, that would be great. Well, wonderful. So, is this kind of like the cutting edge of medicine right now? Would you say, or is that why it hasn't been accepted yet widely by HMOs?
Yes, it's been around for a long time, but the conventional mindset is still very, very strong, and we should really be open to these developments because there have been studies, although it's not as widely studied as the ones in the conventional, but there are already studies that prove that nutritional interventions are helpful. There are patients who get well with this approach, you know? And I say that we really have to individualize our approach to treating the patient. So this is the new thing that all doctors have to be open with, because
So
not all illnesses will be addressed by medications, by the things that we learn from med school.
So there's a bigger world out there to be explored, no?
We should always be on the investigative side and always try to search for things that will be helpful for the patient.
I think there's different types of medicines around the world for the Chinese medicine. I've heard that in Nepal, was it Nepal? No, in Tibet. A Tibetan Chinese doctor can diagnose 3,000 illnesses just by checking the pulse alone.
Yeah.
Just checking the pulse,
Amazing.
right? Which is amazing, right? 3,000. I don't even know, wouldn't even know what to check for on the pulse, right? That would give me 3,000 different symptoms or distinctions to look for in the pulse. Yeah, and so that alone, I think, should give us maybe a hint or a clue that, hey, really, there might be something to this. Maybe there's something out there. And actually, you also have very modern equipment that sort of does this kind of thing, right? You have a NASA developed program that can check a patient through a computer program. You put your hand on this palm rest, right? And the computer looks for certain currents, and it sees what your body is stressed by, what could relax or balance your body. You know? So can you say a little more about that?
Bjorn, when you said NASA, it's like space technology.
That's right, right? Is that correct?
Yeah.
Did I say that correct?
Yes, we call it limbic stressor assessment.
Okay.
And there are already informations in there. We call that digital information in the system. Say diseases, organs, heavy metals, bacterial, virus, fungi, and all other stuff that can stress a person. And those digital, there are also what we call balancers, which are nutrients or interventions that may be helpful for the patient. So this gives us an idea of how the patient responds to these forms of stressors. So this gives us a clue into what the patient is more stressed about, even if the patient doesn't feel it. Okay, so if there are heavy metals or virus or fungi that are predominant, we will see it there because there will be a corresponding score. So those that are have more negative scores farther from the range, we have we call a good range for the patient. If the scores of that particular stressor is far from the range where the body can handle itself properly, then we try to use the balancers that we also get. Say hormone replacement or nutrients or chelation therapy or biooxidative therapy and other forms of healing forms. We utilize that so that the body will be helped.
So this is kind of like a diagnostic tool, right? We
don't really call it diagnostic, but we call it as how do we call it? It correlates very well with the laboratories.
Okay. So it's like an additional test.
It's an additional information that we see.
In addition to the normal standard tests,
yes,
like blood tests, urine
like
tests.
Like a blood test, yeah. Okay, so for example, for a patient, for example, with cancer, where we want to know what is more predominant stressor in the body. So we would see, for example, pesticides, then that and other stuff, maybe chemical exposure to maybe radiation. So we will see that, even if the patient could not even recall when that happened, and once we ask deeper, then he would, oh yes, I remember I was exposed to this radiation a long time ago. So with those information, we can customize or prioritize what the patient needs. So
certain
we need
treatments.
Certain treatments, in addition to the protocol that we are giving.
Beautiful. So we actually reached the end of our time slot. That's very interesting. I think we could go on for hours here. Is there anything you'd like to say in closing, and maybe also how can people get a hold of you or get in touch with you?
Dr. Sharon, I think it's the most important.
Well, I would say that let's all be conscious about our health. Let's be proactive. Let's not wait for serious illnesses or repeated illness to draw us to the doctor. Better yet, let's find ways of improving ourselves, and that's how we can help you. You can consult us, and our clinic is located at the 3rd floor, Advanced Natural Healthcare Center, at 3rd floor of Medicard Lifestyle Center.
That's on Hilpuyat and Corner
Hilpuyat and Paseo, Urdaneta.
You have a phone number there for people, or?
My number is, the clinic's number is 899, let me see.
That's important, no?
Yes, please call us. You can call us at...
Everybody get your pens ready. And your paper or your smartphones.
887-5599.
887-5599.
And our clinic mobile...
Makati City.
Makati, yes. And our clinic mobile is 0917-7761-969.
Beautiful. Vicki, anything in closing?
For me, the eye opener is, you gotta protect your gut, because 70% of all your immune system are actually focused there. You want to protect your body.
Beautiful, right? Yeah. So thank you very much, Dr. Sharon, for being here with us today. Very interesting. very insightful and enlightening. Hopefully we can have you again sometime in the future.
Sure, thank you very much.
This is
also.
Bjorn Martinoff, Vicki Martinoff, on behalf of Marlene Craig, signing off for today. It's been a pleasure. Thanks for being with us, and have a great weekend.